Good morning, everyone. Miss Brandy coming to spend a few minutes with you guys. And I wanted to talk to you today about physical medicine and rehabilitation. And that is something that you guys are going to be reading in chapter 26 today. And I'm going to be pulling an example directly from the textbook on page 688. You guys have heard me say to pay attention to the examples because they really help to explain things, and I'm going to show you exactly what I'm talking about with that today. So, to get started, a little bit about the physical medicine and rehabilitation section. The code range is the subsection 97010 to 97799. Okay, and those can be reported by a physician or a therapist. The subsection includes codes for all different types of rehabilitation services, such as traction, whirlpool, electrical stimulation, and then they also include codes for patient training in rehab, like gait training or massage therapy and things like that. These codes are reported generally on a basis of time and treatment area. And you can look in the definition of the code in the tabular index, and it'll tell you the time frame that they go by. Okay. And these codes are going to be divided by supervision or constant attendance. Okay. And it also states in your book that unit coding, i.e. times 2 or times 3, is necessary if the time spent administering the treatment exceeds the time listed in the code. So for the example that they used in the book, I'm going to share my screen to show you guys quick slide example. Okay, and again, this is from page 688 in your book, and the example tells us this. Reporting patient's initial prosthetic training of 60 minutes would be, and you would use code 97761, and if you read the definition, prosthetics training, upper and or lower extremities, initial prosthetic encounter, each 15 minutes. So we had 60 minutes for our scenario, so it would be the code times 4, okay? So really simple and easy example to kind of help you break down things. In the definition of that code, it says 15 minutes, but we had 60 minutes of training, so it's got to be times 4. And that's our correct coding for that. And like I said, guys, the examples in the books are really, really great at helping you understand exactly what they're talking about when they're talking about how these codes need to be used. And one other quick thing to bear in mind, if you guys ever work in the front end of the office and you're doing prior authorizations and things like that, sending out for referrals, all services provided by independent physical therapists and occupational therapists require a written referral from a physician, and that referral has to include documentation of whatever disease or injury that patient is suffering from and needs treatment for. All right, so just some snippets, and I hope this helps you guys. And of course, as always, thank you for your time and have an awesome day. Bye-bye.